If you have a patient that requires heart surgery today, the Uganda Heart Institute may not be the place you will turn to because it's already suffering a backlog.
The backlog is about 500 patients. But what we are saying, those ones are the ones who need surgical treatment, but all them say open heart surgery. The critical emergencies are usually about 10 to 20 per day.
This challenge is mainly caused by a shortage of critical cadres and operating space.
More intensivists. These are the people who look after the patients in the critical care in the ICU. I need more anesthesiologists, cardiac, both adult and pediatric. I need more surgeons for both adult and pediatric. I need more cardiologists for both pediatric and the adult. Then there's the category of nurses. We need more of the nurses in the intensive care nurses, the ones in the surgical ICU, the one in the cath lab. So all those ones have separate training programs, which transform them into that. Then I need more perfusionists. These are the cadre which operate the heart-lung machine during the time when we have stopped the heart. We only have 2. I need at least another 3.
Dr. Omagino says the institute has no capacity to hire specialists. In fact, they failed to spend 420 million shillings after they could not attract specialists like consultant pediatricians and cardiac surgeons in the 2018-2019 financial year.
Our salary and pay cannot attract the people that we want. The model we have done is to design our own fellowship training, which gives them 3 years of training. But the 2 are here where they are full hands on. Then they go out for 1 year.
For now, you will likely be referred to private facilities, which Dr. Omagino says is acceptable.
Such that we have an alternative situation, such that in case anything happens to our machine, for example here, because it is one, we have an alternative.
However, more than 80% of heart diseases are preventable. But more than 80% of people with heart complications here in the country do not know they are sick.
At the moment, about 25% of adults above 18 years old, from the survey that was done in 2014, have high blood pressure. Smoking is one of the leading causes of atherosclerosis. And atherosclerosis, or the deposition of fat in the blood vessels, is one of the leading causes of heart disease, heart attacks, and even blood vessel diseases.
The institute is able to diagnose and treat 90% of all heart complications in children, despite the hardships.
So we know that we have a huge challenge to reach out to all the children who are born with heart diseases, because we know that out of the 16,000 who are born with heart diseases, probably 50% are mild. So it means about 8,000 are severe enough to need attention. But commonly known in the population is the children being born with holes, children having holes in the heart.
The institute has also set focus on pregnant mothers.
Mothers who are pregnant have signs and symptoms, especially during the first trimester. So these particular signs and symptoms of early pregnancy can actually resemble or mimic signs of heart failure. So commonly these mothers come to you with getting tired easily, what we call exertional dyspnea. Then commonly you see mothers who are pregnant with swelling of their feet, which is exactly similar to patients who have heart disease or heart failure. These mothers actually also complain of palpitations, a feeling of your heart racing beyond the normal speed of the heart.
The experts say good feeding habits and reducing the sedentary lifestyle is key for a healthy heart.
Diet is a very, very big contributor to heart disease. And if we can modulate or regulate our diet, then we can make a big difference in preventing heart disease. Regular exercise is good in training our body and in the process training our hearts. Sedentary life is very, very dangerous because one, you do not burn calorie. So the excess calorie you have from excess fat eaten, from excess sugar taken in is all converted into fat, and this fat is likely to be deposited into your blood vessels. And once it does that, then your blood vessels get clogged. And if they are on the heart, then you can get heart attacks. It is important that we modulate our lifestyle, that we get periods when we can rest, periods when we can go out and relax, and we should not be continuously stressed by the work we do, and sometimes even by the problems that we face.
Cardiovascular diseases take the lives of 17.9 million people every year, 31% of all global deaths. In Uganda, the existing data shows that 1 of every 4 Ugandans has hypertension, both in the rural and urban setting. Walter Mwesije, NTV.